The blue state COVID vaccine expansion continues with a coalition of Democrat led states building out a framework for COVID 19 vaccine access. Could this potentially turn into mandates in the future? Hey everyone, I'm Julie Barrett, founder of Conservative Ladies of America, and I want to give you an update on the blue state COVID vaccine framework that we have seen being built out. Specifically, this seemed to start with the West Coast Health Alliance, which is California, Oregon, Washington, and Hawaii joined the alliance about a week after they formed. These states have all issued standing orders through their Department of Health to make the COVID-19 vaccine available for all citizens over the age of 6 months without a prescription. Now, this is in direct defiance to what the CDC is now recommending with COVID-19 vaccines, where they're saying these are only going to be available for high-risk individuals, people over 65 and people below 65 that are in the high-risk categories, but they're not going to be available for anybody and everybody. And you will need to have a prescription to get the COVID-19 vaccine. So what these standing orders do is they allow pharmacies to give the COVID-19 vaccine without a prescription. You don't need to see a doctor. And in some of these states where they have what is called the mature minor doctrine or something along those lines, it allows children who are minors to get vaccines without parental consent. If the doctor or whoever is giving the vaccine deems that the child is mature enough to make the decision to get the vaccine, they can legally go ahead and do that. Now, I want to make clear that there is no mandate at this time, but what we're seeing with all of these blue states that are making emergency declarations and standing orders within their health department is interesting because there is no COVID emergency at this time. There is no need for widespread vaccination of citizens. And so this is something that we as citizens, especially if you live in a blue state, should be watching really closely. So Arizona on Friday, September 19th, is the latest state to join the coalition of blue states that are issuing standing orders. So Arizona Governor Katie Hobbs issued an executive order directing the Department of Health in Arizona to issue a standing order making the COVID-19 vaccines available to any citizen that wants them without a prescription. Katie Hobbs is the most recent governor to declare such an emergency in her state. In Colorado, Governor Jared Polis authorized a public health order that functions as a blanket prescription similar to Arizona that allows pharmacists to vaccinate anyone 6 months and older without a doctor's prescription or without even needing to consult with a doctor. Minnesota Governor Tim Walz also issued an executive order authorizing the state epidemiologist to issue a standing order as well that does the same thing as what Arizona and Colorado would do. Other states that have done the exact same thing include New York, New Jersey, Wisconsin, North Carolina, and Connecticut. Now, in the case of Washington, Oregon, California, and Hawaii, the state medical boards were able to act independently of an executive order from the governor because you had this West Coast Health Alliance. But other states that have done something similar where the health executive was able to issue these orders without an executive order include Pennsylvania, Massachusetts, New Mexico, and Virginia. Virginia's is slightly different, though, in that the standing order is only for people 18 years old and over. And keep in mind that Virginia has Republican Governor Glenn Youngkin, and he has not issued an executive order. Now, this is something to watch because, as I said in the beginning of this video, there is no COVID emergency right now. There's also no mandate in any of these states. But if you watch how they're building out this framework to make these vaccines readily available for anyone who wants them without a prescription, they're going against what the CDC is recommending, and they're citing Big Pharma-aligned organizations like the American Academy of Pediatrics. This is something to watch because as we continue to go into what is normally known as flu season, which has become COVID season over the last several years, this could lead to something more restrictive where there are some kind of mandates or guidelines going forward. I don't want to alarm anybody, but as we see these things get built out, it's a sign of things to come. And if we learned anything during COVID, it is that we need to be watching what our government does when things are peaceful and calm, what they're setting up for, which may come next. So I just want you to be aware and alert and on guard and paying attention. Please be sure to share this video far and wide. I'm going to have a link in the description to a few different Substack articles that we have put out on the blue state coalitions for the COVID-19 vaccine. Thanks so much for watching, and I'll see you in the next video.